health is very important. Okay. But all we look at how do we define health? We know that when 6 blind people were describing an elephant, so one was telling it is a rope, someone was telling it's a wall, someone was telling it's a tree, someone was telling it's a snake. Something like that. We always look at health in very, very narrowistic view. But all we look at what is health, there is a very comprehensive definition from World Health Organization. We think that uh, like we always think that health is something like if we don't have any disease, that is health. That actually is wrong. Like for example, I get up in the morning, I have my breakfast, go for some roaming, come back and sleep again, eat lunch, but I don't have disease. That doesn't mean that I am healthy. But all we look at the basic definition of health, which is given by the World Health Organization. It is not mere absence of disease. It is physical, mental, social, spiritual well-being. So, what does this mean? Like, see, for example, many days, though we are working from morning till evening, even at the fag end of the day, if someone ask us for go for a 100-meter dash, like we will be happy to do it some days. Sometimes just after 1 hour after our working, if someone tells go for a 100-meter walk, also will not be able to, because it all depends upon how happy we are, or how much we are able to perform. How much we are able to perform depends on our mind status. So, if at all we look at, we have 2 eyes, one nose, one mouth, 2 hands, 2 legs. But if at all one hand doesn't work, we can work with the other hand. If one leg doesn't work, we can walk with the other leg with some sort of help. But we have only one mind. If mind doesn't work, nothing will work. So, if at all we are happy mentally, if at all your mental health is good, or physical health will also be good. So, how we will be happy mentally? Like apart from 8 hours of sleeping and 4 hours of daily course, most of the time we are with someone else. It may be our parents, or with our spouse, or our colleagues, or our students, or our patients. Like 90% of the, like almost half of our life we are spending with others. So if at all we are spending with others, early part of my career, one of my major area of interest was what is happiness and what is success. Are all happy people are successful, or all successful people are happy? That was my question. Can I ask, like, I know that it will be monotonous if I talk continuously didactic like this. Like, can I have some interaction? Do you people think success and happiness are the same? Anyone?
No, sir. No, sir.
Exactly. So, how do you define success, madam? How do you define happiness?
Success can be measured like any award, like no.
Exactly.
In terms, yeah.
Exactly. Like happiness.
Happiness is mental feeling.
Exactly, madam. Similarly, we did one study. We interviewed a lot of people, starting from a lay person to celebrities, cricketers, like actors. Like many people were successful, but they were not happy. People who are happy may not be very successful also. So, like, how can we define happiness? Anyone else? Like,
It's a
what is
state of
happiness?
mind. It's a state of mind.
Excellent, madam.
Mental wellness, sir.
Mental wellness. Okay. Anything else? Excellent. Mental wellness, state of mind. Anything else?
So when we are satisfied with everything.
Sir,
When
physically
we are
fit,
satisfied with everything. Excellent. Very nice. Very
physically
nice.
fit, mentally fit, socially fit.
Exactly. So people who are very successful may not be happy, Because happiness can be have a small definition of happiness. Accepting the inevitability of the situation is happiness. Like all of us, whether you know me or not, you are all here. Someone is coming, he is talking, whatever he talks, you are accepting. So you are sitting and listening, and you are not doing like this or this or anything, because you have accepted the situation. So if at all we want to be happy, like if at all we have quarreled with our colleagues, can we be happy at home? No. Like if at all we quarreled with our parents or our spouse or our children, when we go to the office also, we will not be happy. So this social quotient means like the social happiness, it depends on how we interact with other people. So like how, if at all we are harmonious with the other people, then you are socially happy. If you are socially happy, definitely you will be mentally happy. If you are mentally happy, physically also you will be better. So how can how this social happiness is determined? Like the last component of spiritual where I was talking about. What is the spiritual? Spiritual is like many people tell, like there is a person who sits in Kailash, like has a lot of hairs on the scalp, and it talks something like, is that spirituality?
No, sir.
Exactly. So then what is spirituality is the question. Like renouncing everything is spirituality.
So it is related to our soul, spiritual.
Exactly. So how can we be what how like I know like the madam brought one wonderful concept of related to soul. Like as a normal people like us, we don't do a lot of penance, or we don't do anything. What is spiritual health?
So that means like, you think that nothing is ours. Nirliptate. In Kannada.
ನಿರ್ಲಿಪ್ತತೆ, ಕರೆಕ್ಟ್ ಸರ್,
Yeah.
ಫಂಟಾಸ್ಟಿಕ್. ಅದು ಅಷ್ಟೊಂದು ನಿರ್ಲಿಪ್ತತೆ ನಮ್ಮಂತ ಸಾಮಾನ್ಯ ಜನಕ್ಕೆ ಬರ್ಸ್ಕೊಳಕ್ಕೆ ಹೌ ಪ್ರಾಕ್ಟಿಕಲಿ ಪಾಸಿಬಲ್ ಸರ್?
I think we need to experience the practical, whatever is going on with our experience and the society. When you understand, say, by the time, whatever we are thinking of making money or anything, so not, at the end, there is nothing.
Exactly. Like if at all, the best example for a spiritual being is that lotus. Where does lotus stays? Lotus stays in a dirty pond, sir. But at the same time, neither it runs away from that dirty pond, nor it stops spreading its beauty. So the epitome of spirituality is a lotus. Certainly, we all know that every basic structure is from an atom. Atom has protons, neutrons, electrons. So, like equal number of positive charges are there, equal number of negative charges are there. From the atom, there is a molecule. From molecule to a tissue to a organ, then the whole human being. So, any person, if I look at negative in him, I'll hate him. If I look at the positive in him, definitely I'll respect him. So the spiritual health for me is like being in harmony by looking at the positive side of an individual. If at all you look at the positive side of an individual, you will be always harmonious with that person. If you're spiritually healthy, you're socially healthy. If you're socially healthy, definitely you're mentally healthy. If you're mentally healthy, you're physically also healthy. Like so many diseases we are seeing, everything, if at all you see it, there is an explanation based on this. I always love this quote from John Milton. The mind in its own place and in itself can make a heaven of hell or a hell of heaven. So that's where we how this stress starts. If at all you look, when the evolution, when human beings evolved, we were all hunters and gatherers. So like whenever we wanted to eat something, we should hunt something and eat. At the same time, other animal will also be in competition with us to hunt. So like when we are hunting another animal, there is another bigger animal also hunting, and we always had that stress from the beginning. But when we were in college, whenever the Rakhi festival is there, we will definitely feel very stressed because which girl will tie Rakhi? Once we grew up, when we are proposing to a girl, we had a lot of stress. When we become parents, like our children do all these things, they watch TV, mobile, everywhere, we are stressed. You go to office, so many works, so much of stress. With wife, I always tell it be very difficult to handle. Like again, they stress. So everywhere there is a stress. So how we handle that stress is the point which will determine our health. Like what are the health hazards of stress? I'll be talking later. I always ask a question to many people. When we compare male brain and female brain, which brain is bigger?
Sir, I think female.
Any other answer, sir?
Female,
Sir,
sir.
Actually, male brain is bigger, madam. Almost male brain is 75 grams bigger than the female brain. But still, like I always tell, male brain is like a desktop. Bigger space, lesser work. But woman brain is like laptop. Lesser space, more work. But at the same time, they always like in the movies there is a dialect it stronger. Actually, um, woman brain is more efficient. But the point is, though the male brain is bigger than the female brain, there are two structures in female brain. You can look at this picture. You can see this hippocampus down. You can see that hippocampus down, down right. Next to that is an amygdala. This hippocampus is the one which gives memory. That amygdala is the one which gives us the emotion to that memory. So these two, though the woman brain is smaller, these two structures are very, very well developed in women. So always I see husband and fighting. Wife will be telling that this fellow gave me a gift for the first anniversary. That was so bad. But this fellow will not be even able to remember that first anniversary. So though woman brain is very efficient, if you look at the younger age, then you will understand. If you go to a school, in the kindergarten school is where you can definitely see the difference. You can see all the girls will be sitting very disciplined with the uniform, but the boys will be roaming around here and there. If you look at even in the womb, in the first 3 months of the intrauterine life, the maximum number of abortions happen is the male because of that Y chromosome. But the first 5 years also, the maximum number of attention deficit hyperactive disorder, autism, everything is more common in boys. Almost the ADHD and all 1:4 proportion. But as the women grow older, the amount of depression, anxiety is actually more in women. One reason is that the hormonal changes, like they have the menstrual cycle, and men will never become pregnant. The pregnancy, the postpartum, the menopause, all these hormonal changes which have a significant impact on the brain is the reason why the anxiety, stress, depression are more common in women than men. And also in India, the multiple roles a woman takes over, maybe a mother, a daughter, a entrepreneur, maybe an employee, employer. So many roles women takes up. That is the reason why many disorders like depression, anxiety, or stress is more common in women. So, like another cause for stress is that all of us work in different teaching institutes, right? So here, what is happening is like information is doubling every 6 months. Like what we have learned, it will become obsolete in another 2 years. So, like we are always bewildered by this information explosion. Like how to keep up with this information explosion, that is one of the cause for our stress and feeling overwhelmed. One small point I want to emphasize is that when we are inside the womb, in our mother's womb, like at the 3 weeks, the neurons forms at the rate of 250,000 cells per minute. At birth, we have around 100 billion neurons, each making over 10,000 connections. But when we compare to other animals, humans have something like a triune structure in the brain. You can see in the slide, the lower part is the reptilian brain, the middle one, the pink one, is the paleo-mammalian brain, and then upper one is neo-mammalian. So we have a triune brain structure, and this gives an edge over other animals, that only the human beings learn from their mistakes. At times, we always go into our ancestral origin where we never learn from our mistakes. The point is why we should learn about this stress or anxiety. Because if at all one person doesn't work for one day, means like one day lost. If you look at the population, because of anxiety and stress, almost 7,60,000 days are gone every year. There was a World Economic Forum which happened in 2019. They found that if at all you invest $1 on mental health, you'll get back $4. So you can see these great personalities. We lost them very early because uh, we did not address their stress. We did not address their agonies. So, like we all tell that stress, each of us deal with stress in a different way. What are those factors which determine how we deal with the stress? One is like what is our personality? Means like I may be a chatterbox, you may be a silent person, you may be an introvert, I may be an extrovert. One that also determines how we deal with stress, and also how we were brought up in our childhood also constitutes what determines about the stress. Like I'll display one small video where you can see how each individuals respond to stress. Sorry. So you saw that picture. See, like you have heard about this inferiority complex, anyone? Yes. So inferiority complex is one thing which was given by someone called as Alfred Adler. he gives an example how each individual, he gives one story like where a mother takes three for children to a zoo where there is one cage. Inside that there is a huge tiger. So among those three children, one child will be, it will never face the tiger, just he hides behind the mother. The other child will go near the cage, but he pees in his pant. At the same time, he will tell, I can face the tiger. Other child would be shivering, trembling, trying to have peep through the tiger, through his mother's body. So the point is, like all of us have one sort of inferiority. Means like all of us can have our own like what profession we choose, how we interact with people, how many people we make friends. Everything depends on our inferiority complex or where we want to feel superior. Those are the places we settle down. See here, there is a tiger which is actually tied, but these people are not able to understand it is tied. So what is this called as? For example, this is a picture where this you can see here. You can see this light dims warning of impending shock. Whenever that light is there, there will be a electric current pass through this mat. Okay, so if at all the dog puts the leg when the light dims, it will have shock. If that that it is not the light is not focused, then there is no shock. But the point is, dog learns that there is a shock there, so it will never try to go. Because many times what we do is there is a bad event which happens which is not under our control, but we learn something where this bad thing will ever happen. Means we perceive lack of control and will generalize it and will never attempt that. For example, I was seeing a girl who used to visit my clinic in Mangalore, where she was a student of NITK Suratkal, where she had lost her exam in her third semester because of severe fever. But till her seventh semester, she was not able to go to the exam because she thought whenever she goes to that exam, she gets a thought that I am a failure. But if at all we look at her past record, she has written more than 38 exams. Everywhere she has scored at least 98%. Many times, certain of the circumstances where we feel helpless only because of the situation, we generalize it. That is called as learned helplessness. That is also a cause of stress. Like today's topic is on stress. Like what is stress? Stress is nothing but, for example, if you get fever, you will think that, okay, I'll take one Dolo 650, I'll be happy. But if at all your parents get fever, or your children get fever, or your loved ones get fever, that time the same attitude will not be there. That is where stress happens. Stress is what arises when something we care about is at stake. Okay, that is stress. Well, what is anxiety? Anxiety is something where we are always occupied with something negative, threat, uncertainty. All the time, we are occupied with the thought of something threat is happening, some uncertainty is happening, some negativity is happening. That is anxiety. This is a curve called as Air-Knudsen curve. Like I looked a lot of people here, and many have on their video. Most of you look very disciplined and studious. Like at times, if we never had exam, had we studied so much? Many times when that dead point comes, another 2 weeks is there, then only our performance keep increasing. So if at all there is no stress at all, we would have enjoyed life much better, no performance. Like that is something like you can see that x-axis and the y-axis here. The x-axis is the stress. Like certain you can see that when the anxiety increases, the stress increases, the performance keeps on increasing. You can see on the screen. At one point of time that starts decreasing. So the stress which improves our performance is called eustress. The stress which decreases our performance is called distress. So there are some good points about stress which will cause us excitement, which makes us more creative, which makes us more achievement oriented, which increases our productivity. The bad part of stress is that it causes boredom, it causes frustration, it makes us distressed, and we always get occupied about the failure. It causes indigestion. The ugly part of stress are many are there. What are those ugly part of stress? Lot of headaches happens because of stress. Many times our heart attacks, you see lot of heart attacks happening. All this myocardial infarction is because of stress. Many people, you know that our gut is almost 25 feet. Once they eat, suddenly they want to go to the washroom, because like to travel from that esophagus stomach to the gastric emptying time itself is 3 hours. Everything to reach the rectum takes lot of hours. Because of stress, there is something called as a gastrocolic reflex. They suddenly wants to go and pass uh, stools. This is also because of stress. This is called as irritable bowel syndrome. Lot of arthritis which is happening. There are a lot of women here, hair fall, acne, psoriasis, brain strokes, neuropathies, obesity, and most worst and the most bad thing is whenever more stress is there, they'll reach a level of hopelessness that may lead to suicide. That is the biggest thing. Like I always tell, whenever anyone invites me for any talk, even a single person is there, I would like to go, because I was just treating one of a senior superintendent of police who runs lot, who is a philanthropist, he has opened so many free hostels. His son committed suicide when he was young. So now also that person, that senior citizen always tells me, Doctor, COVID nodre nanu sukkobiಡ್ಬೇಕಾ. So the stress can lead to suicide. The one of the most preventable cause for death is suicide. Somewhere that is not addressed properly. So how to ward off this stress? There are few general points I'll tell, and there is one more important thing what I want to discuss is about resilience, which is something called as the buffer for stress. One of the most important thing what leads us to stress is not prioritizing the tasks. Like we have something like today, I want to give a lecture to you. Second thing is about there is exams tomorrow, so I should keep all the cases. I also want to eat some ice cream today, or somewhat I want to eat some good food in some good place. But most important task is I have agreed to give a talk to you that I should prepare. I don't know all the things. I will go and eat, and that is not the priority. Means like prioritizing the task is very important. Because for example, in our emergency department, we have a capacity of 10 to 15 people casualty. Like if there is a huge bus accident come, that time we get 80 people. We will not be able to cater to 80 people at the same time. What we do is something called as triage. What we triage means like we'll see all the patient 80 patients in 80 minutes, or 80 like within half an hour, all of them. So we give someone red card, someone yellow card, someone green card. Red card means immediate they require attention. The yellow card we can wait for 1 hour. Green card, even if you don't give attention, they're not in an emergency, they don't have a life threat. So similarly, we should also do some triaging in our day-to-day work. What task should be first priority, second priority, third priority? If at all we make that listing, almost we'll be very stress-free. So not delegating responsibility. See, many times like a good leader is the one who delegates responsibilities. Like you become like now you are maybe an assistant, associate, professor, then you become HOD. Like you are given a HOD post or a bigger post because they know that you will manage people, not that you work. See, like it is inhuman to do every work. Until unless you delegate responsibility, then you will always be stressed. Many times, everything we can't do. Certain things we know that it is not possible to do, but still, because of something they are not able to say no. Until unless you say start and telling no, you'll never be stress free. And most important thing which causes stress is procrastination. We keep postponing, postponing, postponing. So, and whenever we have some task, and we want to reach a deadline, we should meet that deadline. Then we should write down the objective of the task. Whenever we know the objective, what we are doing, then only we will be able to do that work properly. So always documentation is very, very important. But a lot of paperwork always lead to clutter and unnecessary stress. So the priorities, like for example, when there is an urgent task, you should always prioritize what you should do, what you should do next, those things. And if you don't plan, if you fail to plan, uh, you'll fail in your task also. So one video to show how successful and unsuccessful people be. See, all of us have almost same IQ. The biggest problem is this EQ, emotional intelligence. That's where we are lacking. Like if at all we are emotionally intelligent, we'll always be successful. What are these components of emotional intelligence? One is like realistic self-assessment. What is this realistic self-assessment? It means like know thyself is the quotation quote given by Hippocrates. Like many things, first of all, we should understand we can't do everything. So don't undertake the things that you can't complete and remain consistent in your goals. First of all, like you have some of the very good talents. Some things we may be deficits also. So always nurture your positives, work on your deficits, but don't ever bother about your deficit. Don't creep about your deficit. Then second thing is like you should define what is your interest, what is your skills, and what is your value system. If at all you don't do this, then it will be very problematic as well as stressful. For example, like your interest may be in something, like it may be a research or it may be teaching, and whether this interest matches with your skill. You may be a very good communicator, and your good communication skills definitely help in your teacher. Fantastic. Values, like what are your values? Like there is nothing right or wrong in this universe. Someone tells right, someone tells wrong, doesn't matter. But what is your value system? What you want to earn? What are your targets? Those things should be very, very clear. The third thing is about motivation. See, like we keep goals. Like for example, at the end of this year, I want to make some 10 publications or 5 publications or 2 publications, whatever the target might be. First week you do something, second week you don't do anything, then everything will be toss. So every a long-term goal should be there, a short-term goal should be there, and these goals should be catered like at the end of 1 week, at the end of 1 month. What are the progress you should always think about? The fourth thing is about self-regulation. What is this self-regulation? The biggest challenge we all face is our anger. Anger is something which is very common to all of us. But how we react in the anger is the most important thing. I was taught that when you are angry, you should count 1 to 10. I am angry, I slap someone, then count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What is the use? The biggest issue is like how to control anger. The first point is when you are angry, there is some bodily changes which are happening. For example, when I am angry, I was a very like short-tempered person. Like when I finished my MBBS, I was working in a primary health center for a year. The primary health center was in somewhere in the tribal area where people were really poor. Like we used to do every surgeries to myocardial infarction to dentist job, everything because they didn't have money. There was only one person coming and going. So whenever we used to do diabetic wound dressing, everything because they didn't have money. If I don't do that, they can leg will get rotten. So whenever my assistant never give me one forceps or some scissor or something artery, but is to feel very upset and throw something, it will get broken. Every time something is broken, government will not provide me. I should only procure it again. So all my salary is to go in procuring whatever I had broken. So then the first point was I wanted to control anger. I just trade this 1 to 10 after breaking the thing. So what is the use? So the first point in anger management is that what is the physical change that happens when you are angry? For example, when I am angry, I feel that my thighs are shaking, or sometimes I feel that there is a Bunsen burner behind my ears. I've checked in the mirror. There is nothing like redness or nothing, but that is the feeling I get. So once there is a physical change, then only their anger becomes more and more. So I request all of you, the first step in anger management is that you should understand what is the physical change, which is very much tailor made for you. So once that, for example, when I get angry, my thigh starts trembling or my ear starts burning, that time, what I'll do is I'll just get away from that place. For example, if I am angry on this laptop, if I get away, then again I want to come and break this laptop. That is the next question. Like when even I move out from this place, again, that anger is not gone. That is the time when either you can make a call to someone. After that, if even after that it is not possible, then you can count 1 to 10. Anger is something like a wave in the sea. When you are standing on a seashore, when the wave is coming, you feel that that will take away you, but it will come and go. This is also like that. It's a wave, it comes and goes, but how we handle that wave is very, very important. So for emotional intelligence, you should have self-regulation. You should know thyself. You should know your values, interest. Then the most important thing is empathy. Like if at all I address that I did this, I did that, no one will listen to you. Something you should understand it whenever we talk about we rather than I, it will always be better. So always you should remember this karma returns. 1 second, I'll display a video. It's a wonderful one. So, until unless we address others, until unless we at least consciously we don't do anything wrong to people, that will always help us. So I always talk about this mind medicine. What is this mind medicine? Is the secret power of healing. It's a powerful healing. What is this? It's all about positive thing. What is this positive thing? If you look at a 5-year-old boy, that boy or girl gets everything because they doesn't know what is negative thinking. But as we grow older, our data suggests that 88% to 92% of the time we only think negative because our brain is programmed like that. So how to think positive is like if I get a thought that I am having a heart attack, that is a negative thought. What is a positive thought for that to replace that? Anyone?
My heart is healthy. Feeling that my heart is healthy.
Excellent, madam. That is the negative, positive thought. Most of the time, we always we tell that I don't have an heart attack. Like I don't have, brain will never scan. It will only scan heart attack. Don't, my heart is healthy is the right positive talk to that. So, like most importantly, we always feel sad. We always feel distressed because we always complain. You just see this video; it's a wonderful one.
Sir, the video is not audible, sir.
ತಪ್ಪಾಯ್ತು.
So the next point what I want to emphasize you about is that uh, one point I personally work on is about this resilience. We all know that our generation, the biggest curse for our generation is COVID-19. Many of us lost our so many relatives, like so many things we lost during that period. Before COVID-19 was very rampant in Italy. Like as Madam was introducing me, like I keep writing certain articles to different journals. You all know that certain journals charge humongous article processing charges. Once in 2019 December, I received an invitation from a journal asking for to write something about resilience. Then I thought, like, I wrote back to them, if you waive off this APC only, then I will write. They told yes, and I wrote an article on resilience which was not even my cup of coffee. But Italy is a similar place like Mysore, where we Mysoreans, like, we are almost having addiction to stay in Mysore. Though we get a lot of opportunity elsewhere, we don't go because we don't have any. We never get droughts. We have never had volcanoes. We never have earthquakes. We never have celestial rains, drought, nothing. We are never exposed to any adversities. If you look at Japan, so many earthquakes keep happening, volcanoes, so many things will be happening. But we were never faced with any adversities. The biggest adversity was this COVID. We were never prepared for that because we have never seen huge adversities like calamity, natural calamities. We are not exposed. The huge pandemic hit us like a flash of light. That's where many of us, many people died because of stress. Many people died because, at some point of time, even I had given up. What the hell, what we are doing? We are standing next to the patient. I work in JSS hospital where the highest number of beds were provided from JSS. We had three ICU specifically for that purpose. The first bed in our MICU is the most sick person. So that person would die, we knew that. The next bed will be waiting for his turn when he will be shifted to that bed. One point of time, I felt like, what the hell we are doing as doctors? Many people are dying. What? We are not able to do anything. The biggest point was in COVID, we had two things. Either there was immunity, there was inflammation. If they go into inflammation, if that cytokine storm happens, everyone will die. If that immunity comes, nothing will happen. You are clueless who will go into this cytokine storm, who will go into this immunity phase. So that is the place where we should be resilient. What is this resilience? Resilience is a physics concept. For example, this is a plastic. I apply pressure on this. When I leave the pressure, it will come back to its normal shape. That's what this resilience is all about. This resilience is the capacity to bounce back during stressful situation. Like, what is this? This is the adaptive capabilities which makes us better equipped to handle the psychological toll we are facing. Whenever there is an anxiety-ridden environment, this resilience represents our rebound, our capacity to bounce back. Sorry, something has happened. Sorry, like some technical glitch had happened. Again, I'll share the screen. So, like we were talking about COVID-19, we tell it is one second, somewhere disconnected. Some slides are not moving, that's why I'm doing this exercise again. Sorry for this technical glitch. So we always told that this uh, okay. So we always told that it is a novel coronavirus, but if you look at earlier part also, there was something like plague in 2000, like 150 BC, AD, 150 to 200 AD, where if you look at our Bhairappa's novel, ಒಂದು ಗಾಡಿ ಹೆಣಗಳು ಬಿದ್ದೋಗ್ತಾ ಇತ್ತು, ಗಾಡಿಲಿ ಹೆಣ ಹೋಗ್ತು, ಅದನ್ನ ಬಿಟ್ಟು ಬರತಂಗ ಇನ್ನೊಂದು ಗಾಡಿ ಹೆಣಗಳು ರೆಡಿ ಆಗಿರ್ತಿತ್ತು. That was the time there was this plague worldwide. That was again a pandemic. There was a Roman emperor called as Marcus Aurelius. He was attacked with the Greeks in the Greeks in the border. After he fought that war, comes back to his place to see a lot of people dying because of this Antonia plague. He was a prince. He had a huge palace. He could have stayed there, but he did not do that. He wrote so many things how we faced that horrible situation. His autobiography is called as Resilience. So how to develop this resilience is the question. The first thing in resilience, there are very few small things how to develop resilience. Start the day with the intention. What is this starting the day with the intention? First thing is, like when we get up in the morning, but whether we get up at 4 o'clock, 5 o'clock, 6 o'clock, 7 o'clock, 8 o'clock, does get up, we always think, yo, instead of that, give me 10 minutes. I'm not telling that you meditate when you get up. That 10 minutes, put your mobile in the aeroplane mode, keep an alarm for 5 minutes and 10 minutes. The fifth, like once, just close your eyes. What all things have happened yesterday, someone you would have quarreled with, someone would have criticized it. All these things keep coming to you in your mind. Let it come, let it come. After 5 minutes, you should tell stop. The next 5 minutes, what you should do, I'll tell you. The next 5 minutes, like whenever we purchase a mobile, we look at how much GB is that. So is it 256 or 512 or 1024 GB? Similarly, our brain is also a computer, all of us know. Our brain is like a 5862 GB computer. The point is how we program it is important. Like when I was doing my +2, after I finished my +2, that was the time where C++ was one of the most important computer language they used to teach us. In that language, we programmed the computer a plus b whole square. Already we got the output like that. We used to program and we used to get that output. Similarly, there are a lot of research which tell that our brain responds to C programming. The first 5 minutes, you are just closing your eyes, whatever the thoughts it is coming, you are like just observing. At the fifth minute, you tell stop. Next 5 minutes, what you should do is that you should program your mind. The whole day will be happy. The whole day will be positive. The whole day I'll only think positive. The whole day I will be peaceful. If you do this, it gives you immense results. Though it may look very simple, you just 10 minutes to yourself. The first minute you are just rehearsing what all things happened in the previous day. The next 5 minutes you are programming your brain how it should work. That is what set the tone for the day. The setting the tone, when you start the day of really in the bad mood, it tends to roll downhill from there, and your responses are usually not what you want them to be. So it is non-negotiable for me. It's like if you start, ಇವತ್ತೇನೋ ಕೆಟ್ಟದೇ ಆಗುತ್ತೆ ಅಂತ ಶುರು ಮಾಡಿದ್ರೆ ಪೂರ್ತಿ ದಿನ ಎಲ್ಲಾ ವಿಚಾರದಲ್ಲೂ ಕೋಪನೇ ಬರ್ತಿರುತ್ತೆ, ಕೋಪದಲ್ಲೇ ಮಾತಾಡ್ತಿರ್ತೀವಿ. ಎಲ್ಲಾ ಕಡೆನೂ ನಾವು ಕೋಪ, ಅವನ್ ಫ್ರಸ್ಟ್ರೇಷನ್ ಅದನ್ನ ವಾಪಸ್ ತರಕ್ಕಾಗಲ್ಲ. Okay, like this most important thing is like if I publish an article, I'll be happy. If I get a promotion, I'll be happy. If my wife cooks good food, I am happy. All these things are not possible. The point is, if you want to be happy, no one can make you happy until you are happy within yourself. So First thing in developing resilience is setting the tone for the day. The second important thing is stay in the moment. See, what is staying in the moment is important. For example, there is an inspection in your college, a surprise inspection is happening. They are almost 10 minutes away from your college, and some higher officials is coming to visit your college. The first thing what we start thinking is what all things they will see, what all they will